The idea when we had when we put together this project was essentially to look at the patients that can receive a bispecific agent targeting BCMA that had received a BCMA-targeted therapy before. As you know, on the Majestic trial, these patients were actually excluded from inclusion. BCMA per se was an exclusion criteria. So we don't really know what happens with these patients that have been receiving BCMA-targeted therapies before and then going to receiving standard of care bispecific antibody that targets BCMA again. And so it's a very interesting question that we had. So far, we've done around 50 patients that in our institution that had been treated with Teclistamab. And ultimately, out of those 50 patients, 36 had received prior BCMA-directed therapies, whereas in the form of CAR-T, ADCs like belantamab, or other bispecific antibodies in the form of a clinical trial. When you compare the outcomes that we had on those 36 patients versus what we saw in the original Majestic trial, actually there were very comparable results altogether. We had a very decent overall response rate with around 53% compared to the 63% that was originally presented on the trial that led to the approval of Teclistamab. But moreover, these patients tolerated the treatment very well. Another interesting aspect of what we're presenting is the fact that this population that we had, number one, heavily pretreated with a median line of therapies of 7, which was more than the original clinical trial, but also patients that were frailer. We even had patients that had an eco performance status beyond 2, right, which also would have been excluded from the trial altogether. And high-risk cytogenetics. Almost 40% of the patients in that cohort presented with one of the high-risk mutations that we have in myeloma. So it's very interesting to see that we had an overall response rate somehow comparable, 53% versus 63%, but also the clinical benefit ratio, which would include stable disease and minimal responses, actually was 63%. So it's very encouraging to see that the patients that would have been excluded from the trial because of prior BCMA therapies had a very similar outcome altogether. So that's really cool to see.